welcome to the Deep Dive. Today, we're taking a really fascinating plunge into something quite specific, but incredibly important in equine health. We're talking about purulent nasal discharge in horses.
Right.
Now, if that sounds a bit technical, let's break it down. Imagine seeing this thick, opaque, often yellow-green, or maybe even cream-colored discharge coming from your horse's nostril.
Yeah.
This isn't just like a simple runny nose. Not at all.
Definitely not.
Or think of it more like a serious flashing red light on their health dashboard, basically screaming bacterial infection. And that means, well, without a doubt, it's time to call the vet right away. There's a massive clue if you know how to read it.
You've absolutely hit the nail on the head there. And that's pretty much our mission today, isn't it? To equip you, the listener, with the insights to really understand and interpret those crucial clues. We're going to unpack everything this discharge can tell us, from its color and consistency to the big question: is it coming from one nostril or both? We'll explore the sophisticated diagnostic tools veterinarians use to get to the bottom of it, and then detail the specific targeted treatments that can help these magnificent animals.
Yeah, we should say we've been digging through quite a bit of detailed veterinary material for this.
Yes, definitely. We want to bring you a really well-informed understanding based on those sources.
So let's begin our deep dive then. When a horse has this kind of discharge, the very first, probably most important clue you'll notice is whether it's flowing from just one nostril.
Unilateral.
What we call unilateral discharge, yes. Or from both nostrils, which we call bilateral discharge.
Right.
And this single observation, it immediately helps a vet narrow down the possibilities, like significantly.
Oh, it's remarkable how much that simple distinction reveals. Unilateral discharge, so coming from just one side, it typically points to an issue localized in the upper respiratory tract on that specific side.
Okay, upper tract.
Yeah. We're primarily thinking about the sinuses, the guttural pouches, or the nasal passages themselves just on that one side.
And when we see that one-sided flow, a common culprit, maybe surprisingly for some, is a sinus infection, right? Sinusitis?
That's a big one. Sometimes it's what we call primary sinusitis. This often pops up after a horse has maybe been battling a viral infection.
Yeah.
That virus kind of weakens the immune defenses, and it essentially rolls out the red carpet for bacteria, like Streptococcus species, for example, to move in and set up shop.
Makes sense.
Huh.
But you mentioned secondary sinusitis in our prep.
Yes, and this is where it often gets really interesting and maybe a bit unexpected for horse owners. While you might think of a simple infection first, probably the most common cause of persistent one-sided purulent discharge, especially if it smells bad,
Love the smell.
is often dental disease, specifically a tooth root abscess.
Wow, okay. A tooth causing sinus issues.
Exactly. This connection is a real game changer for diagnosis, particularly involving the last 4 upper cheek teeth. Their roots literally extend right up into those sinuses.
And that foul odor you mentioned.
That's a huge clue. It strongly suggests anaerobic bacteria, or maybe even some necrotic dead bone associated with that dental problem.
That's fascinating. So a tooth problem affecting the sinuses.
Yeah.
What else can cause this one-sided discharge?
Well, beyond those dental issues, secondary sinusitis can also come from things like benign sinus cysts that just happen to get infected, or maybe a progressive ethmoid hematoma.
What's that exactly?
It's basically a blood-filled mass. It usually starts causing intermittent sort of nosebleeds, but if it gets secondarily infected, then boom, you get that thick, purulent flow instead.
Gotcha.
And then, of course, you've got things like trauma, facial fractures, or even less common tumors, neoplasia, that might block normal drainage, or an oronasal fistula.
Okay.
That's an abnormal connection, like a little tunnel between the mouth and the nasal or sinus cavities. All can lead to that secondary infection.
All right, so we've covered the sinuses. What's another significant and really uniquely equine cause of unilateral discharge? I know this one's interesting.
Yes. That would be guttural pouch empyema. Now, to really get this, you need to picture the guttural pouches.
Okay.
Horses have these unique air-filled sacs, sort of diverticula of their auditory tube, located near their ears. In empyema, you get a bacterial infection and a pretty significant buildup of pus within one or sometimes both of these pouches.
And this often happens after strangles, right?
Very commonly, yes. Strangles is a bacterial infection, Streptococcus equi, and when the lymph nodes in the throat area abscess and rupture, the pus can drain directly into these guttural pouches, leading to empyema.
And it gets even weirder, doesn't it, with those chondroids?
Exactly. It's fascinating and a bit Well, gross, frankly. Sometimes that pus can literally dry up and harden inside the pouch, forming these incredibly dense, almost stone-like lumps. We call them chondroids or sometimes concretions. So the discharge from guttural pouch empyema, it can be unilateral or bilateral. It's typically thick, creamy, and yeah, potentially foul-smelling.
And are there other signs besides the discharge?
Yes, you might also spot other things like swelling around the throat latch area, maybe difficulty swallowing, which vets call dysphagia, or even the horse holding its head in an unusual way, an abnormal head carriage.
Okay. What else for unilateral?
Well, finally, for unilateral issues, we can't forget about simple nasal passage masses or foreign bodies.
Like what? Grass awns or something?
Could be something as straightforward as plant material, yeah. Or maybe something more complex like polyps, cysts, or even an ethmoid hematoma or a tumor growing within the nasal passage itself.
And the issue is obstruction.
Precisely. If it obstructs the normal drainage pathway, it just creates a perfect little breeding ground for a secondary infection, leading to that telltale purulent discharge.
That clarifies the unilateral picture really well. Yeah. But, okay, what happens when we see that discharge coming from both nostrils? Does that automatically mean something completely different, or are there overlaps?
That's a really good question. And yes, bilateral discharge generally broadens our investigative scope quite a bit. It most often points towards a problem affecting the lower respiratory tract.
So deeper down.
Deeper down, exactly. We're talking the trachea, the bronchi, the lungs themselves. Or it could be conditions that are affecting both sides of the upper tract at the same time.
Okay. So the first major category here would be lower respiratory tract disease. What kind of things fall under that?
Well, this includes really serious conditions like pneumonia or pleuropneumonia, which are bacterial lung infections.
You'd expect other signs, too.
Oh, definitely. These often come hand in hand with things like a fever, a cough. You'll often see increased respiratory effort. The horse might be quite lethargic. And here's a key point about the discharge itself. The purulent stuff you're seeing isn't just excess mucus from the nose. It's actually pus that's been coughed up from deep within the lungs, and then it exits through both nostrils.
Okay, that's an important distinction. What else in the lower airways?
Another really common lower respiratory issue is equine asthma. You might know it better by older terms like heaves or recurrent airway obstruction, RAO.
Like the cough and the heave line.
Exactly. This is a chronic inflammatory condition, and it leads to an overproduction of mucus deep in the airways. Now, if this excess mucus then gets secondarily infected by bacteria, that's when the discharge can turn purulent.
So you'd see that chronic cough, maybe that visible heave line on the horse's flank.
Yeah, that line is actually muscle hypertrophy, thickening from the sheer effort it takes for them to push air out.
It's also worth mentioning, isn't it, that many common viral upper respiratory infections, things like equine influenza, maybe equine herpes virus,
Yes.
they initially cause just a clear, watery discharge, right?
That's usually how they start, yes. Clear, serous discharge.
But the virus itself can set the stage for trouble.
Exactly. These viral infections, but irritating and damaging the airways, essentially create that perfect breeding ground we talked about. They predispose the horse to secondary bacterial infections taking hold, and that's the point when the discharge often shifts from clear to thick and purulent.
Okay. And one big one we absolutely have to mention for bilateral discharge.
But yes, strangles, caused by that specific bacterium, Streptococcus equis subspecies equi.
Highly contagious.
Extremely contagious. And it presents with very classic signs usually. A high fever, the horse is often depressed off its food.
Then the swollen glands.
Yes, swollen and often abscessed lymph nodes, particularly under the jaw and in the throat latch area. And crucially for our topic today, a profuse, typically bilateral purulent nasal discharge.
And strangles can also lead back to the guttural pouches.
Yeah. It certainly can. As we mentioned earlier, it's a common cause of guttural pouch empyema, and if the infection affects both sides, it can lead to bilateral empyema and that bilateral discharge.
Okay, so you're seeing this thick colored discharge. We've talked about a whole host of possibilities, unilateral, bilateral. Now, how do vets actually play detective and figure out the exact cause? It sounds like some pretty serious investigative work is needed.
It absolutely is. And like any good detective story, it starts with gathering clues, a thorough history, and a careful clinical examination.
Right, the basics first.
Exactly. Differentiating these many potential causes really begins with asking those crucial questions. How long has this discharge been going on? Is it acute, just started, or chronic, been there weeks? What was the onset like? Is it constant, or does it come and go?
Volume, color.
Precisely. What about the volume? The color, is it white, yellow, green, maybe even reddish if there's blood or brown? consistency.
And critically, as we mentioned before, does it have an odor?
Because that foul smell points towards certain things. It really does. That foul odor is a very strong clue, often suggesting anaerobic bacteria are involved, maybe some necrotic bone from dental disease, or, as we discussed, that classic tooth root abscess.
Okay. And beyond just looking at the discharge, what other clinical signs are vets looking for?
Oh, loads. Is there a fever? That points towards infection. Is the horse coughing? Are they lethargic? Or off their food, anorexic? Do you see any facial swelling?
Especially one-sided swelling.
Yes, particularly unilateral swelling often screams sinus or dental issues on that side. Is there any difficulty chewing or swallowing? Increased respiratory effort? Are the lymph nodes under the jaw enlarged like we typically see with strangles?
Checking airflow, too.
Absolutely. Even checking for normal versus decreased airflow coming out of each nostril is a simple but key observation.
And the horse's history is important, too, I imagine.
Hugely important. We dig deep into the horse's background. Their dental history is massive, especially for older horses who are just generally more prone to dental sinusitis.
Makes sense.
Their exposure history is vital too. Have they traveled recently, been introduced to new horses, any known strangles outbreaks nearby? Is there any seasonal pattern which might hint towards an allergic component?
And signs of chronic issues.
Yes, things like any noticeable bony remodeling or facial asymmetry that can tell us a lot about a chronic sinus problem, maybe old trauma, or long-standing dental disease that's been simmering away.
Okay, so after gathering all those initial crime scene clues, the vet's diagnostic toolkit comes into play, starting with actually looking inside, right?
Exactly. Peeking inside literally to find the culprit. A thorough oral and dental examination is absolutely critical.
Often needs sedation, I guess.
Usually, yes. It often needs to be done with the horse sedated so the vet can get a really good look, use a speculum, and properly inspect all the cheek teeth for any signs of abscesses, fractures, or periodontal disease that could be extending up into those sinuses. They'll also carefully feel or palpate the facial bones from the outside.
And then the endoscope. You mentioned this is key.
Oh, endoscopy is truly essential. It's the star witness, you could say.
Ah, I like that.
Endoscopy allows the vet to use a flexible camera, a scope, to visualize the nasal passages, the pharynx or the back of the throat, the larynx or voice box, and critically, those unique guttural pouches.
So you can see where the pus is coming from.
That's exactly it. This is how they pinpoint precisely where the discharge is originating. You can literally see pus draining from the specific openings for the sinuses or coming out of the guttural pouch openings.
And you can get samples.
Crucially, yes. Endoscopy allows for direct sample collection. We can get samples for cytology, which means looking at the cells under a microscope to see what type of inflammation is present. And, perhaps most importantly, samples for bacterial culture and sensitivity testing.
To know which bacteria and which drugs work.
Exactly. Identify the specific bacteria causing the trouble and, vitally, figure out which antibiotics will actually be effective against them. You don't want to be guessing with antibiotics.
Makes total sense. So we're gathering samples via scope. What other imaging techniques do vets use?
Radiography, or X-rays of the head, are also a very common and useful tool.
What can they show?
Well, they can reveal telltale signs like fluid lines within the sinuses showing pus accumulation. They can show thickened sinus membranes indicating inflammation. They're often good for spotting tooth root abscesses, certain types of cysts, or other bony changes that you just can't see from the outside.
And if all that detective work is pointing strongly toward a sinus infection, what's the next diagnostic step, potentially?
If sinusitis is really high on the suspicion list, a procedure called sinusentesis, or sinuscopy, might be performed.
That sounds invasive.
It's a minor surgical procedure, often done with the horse standing and sedated. A small hole, called a trephination, is carefully drilled into the affected sinus through the bone.
Okay. And why do that?
It serves several purposes. It allows for direct inspection of the sinus lining with a small scope, that's the sinuscopy part. You can collect more pus directly for culture, get a really good sample. And, importantly, you can insert a catheter through that hole for therapeutic flushing, which we'll talk about with treatment.
Right. Now, what about if the suspicion is lower down? In the lungs. You mentioned that for bilateral discharge.
Good point. For a suspected lower respiratory tract disease, especially if you have that bilateral discharge, a cough, maybe a fever, you need samples from the trachea or the lungs themselves.
How do you get those?
That's done via either a tracheal wash or a bronchoalveolar lavage, often just called the BAL.
Okay.
The cytology of the fluid collected from these procedures will show specific types of inflammatory cells, confirming inflammation is present deep down. And again, cultures will help identify the exact pathogens, directly guiding that all-important antibiotic selection.
And you mentioned there's this sort of gold standard for head issues.
Ah, yes. When it comes to complex head pathology, there's one imaging tool that really stands above the rest. Computed tomography or a CT scan. It is truly the gold standard.
Why is it so much better than X-rays?
Imagine getting incredibly detailed cross-sectional 3D images of everything, the sinuses, the teeth and their roots, the guttural pouches, all the bony structures. It's just far, far superior to standard X-rays for pinpointing the exact location and extent of lesions, identifying subtle dental problems that X-rays might miss, or finding hidden masses or cysts. Gives you a complete picture.
Makes sense.
And just to reiterate, as we said, bacterial culture and sensitivity testing from any purulent material collected, whether from endoscopy, sinusentesis, or a tracheal wash, is absolutely essential for guiding the appropriate antibiotic treatment. You might also use PCR tests for specific things like the Strangles bacteria, and basic blood work like a CBC or complete blood count can show signs of systemic inflammation.
Okay. So after all this incredible detective work, let's say we have a diagnosis. What does this all mean for treatment? It seems like it boils down to two main things.
That's a good summary. It really boils down to two core principles. One, resolve the underlying infection, and two, critically, restore normal drainage pathways.
And that second one seems key.
Absolutely. It's that second principle, restoring drainage, that often differentiates successful long-term treatment from just temporary improvement or prolonged frustration for everyone involved.
So starting with the infection antibiotics.
Yes, systemic antibiotics are a cornerstone, but crucially, they should ideally be selected based on those culture and sensitivity results we keep emphasizing.
Not just guessing.
Not just guessing. Now, initially, while waiting for results, a vet might use broad-spectrum antibiotics that cover likely culprits, but the goal is always to get specific as soon as possible.
And how long would treatment typically last?
The duration really varies, but it's typically at least 10 to 14 days and often longer, sometimes weeks, depending on the severity, the location of the infection, and the specific bacteria involved. Chronic cases need longer courses.
But you stress that antibiotics often aren't enough on their own, especially with all that thick pus built up.
You're absolutely right. Drainage and lavage, which basically means flushing, are often the most critical component of treatment, especially for infections trapped within the sinuses or guttural pouches.
Why is that so vital?
Because thick accumulated pus, sometimes those chondroids we mentioned, often can't be effectively cleared just by the horse's body or penetrated well by antibiotics alone. It needs to be physically removed.
So how is that done for sinusitis?
For sinusitis, it involves sinus lavage. Remember that small hole, the trephination? After that's made, the affected sinus is repeatedly flushed with large volumes of sterile saline, sometimes with dilute antiseptics added, to literally wash out all the accumulated pus and debris. It might need to be done daily for a while.
And if a tooth is the problem?
If a tooth root abscess is confirmed as the underlying cause, then dental extraction of that specific affected tooth is usually non-negotiable for a permanent cure. You have to remove the source.
What about really bad or long-term sinus cases?
In really chronic or complicated cases, sometimes a more involved surgery called sinus flap surgery might be necessary. This involves creating a larger opening, a bone flap, into the sinus, allowing the surgeon to directly visualize the inside, remove diseased tissue, and perform a much more thorough cleaning and flushing.
Okay. And for the guttural pouches? Similar idea.
Similar principle, yes. For guttural pouch empyema, treatment involves guttural pouch lavage. This is usually done using the endoscope to guide a catheter into the pouch opening and then flushing vigorously with saline to remove the liquid pus and hopefully flush out any smaller chondroids.
What about those big hard chondroids you mentioned?
Yeah, those really large, stubborn, solidified chondroids often won't flush out. They might need to be broken down or physically removed using special endoscopic instruments, or sometimes even require surgery for removal.
And you briefly mentioned fungal infections earlier.
Just a quick note, yes. While less common as a primary cause of purulent discharge, fungal infections in the guttural pouch mycosis are very serious. They can sometimes get secondarily infected with bacteria causing pus, but the primary treatment involves specific, often long-term and expensive antifungal medications. That's a whole other topic, really.
Right. So beyond attacking the infection directly with antibiotics and flushing, What other care is vital to help the horse recover?
Supportive care is absolutely crucial. Things like non-steroidal anti-inflammatory drugs or
Like
NSAIDs.
Butte or Banamine?
Exactly, like phenylbutazone, Bute, or flunixin megalumin, Banamine.
Yeah.
These are commonly used to reduce pain, bring down fever, and decrease inflammation, which just makes the horse feel a whole lot more comfortable while they're fighting the infection.
And general well-being.
Of course, basic good nursing care is key. Ensuring the horse stays well hydrated, offering palatable food because, a sick horse often won't want to eat much, and in severe cases with respiratory distress, more intensive airway support might be needed.
And crucially, if it might be contagious.
Absolutely critical. If an infectious disease like strangles or equine influenza is suspected or confirmed, strict isolation measures are absolutely essential to prevent it from spreading like wildfire through a barn. Biosecurity is key.
So, prognosis. What's the outlook generally?
Well, here's the generally good news. If we can identify the specific cause early and implement aggressive, appropriate treatment like the antibiotics and drainage we discussed, the outlook, the prognosis, for your horse is generally very positive.
But there are caveats.
There are. We have to be realistic. Those chronic cases, especially horses with extensive, long-standing sinus disease, or really difficult dental problems that maybe don't resolve easily, or those horses with huge, stubborn, guttural pouch chondroids. These can become a long, tough, and often quite costly battle to resolve fully.
And recovery takes time, even after the infection is cleared.
Yes, that's an important point. Even after the infection is gone, that amazing internal cleaning system within the airways, the mucociliary apparatus, the tiny hairs and mucus layer that constantly work to clear debris, it can take a surprisingly long time, maybe up to 7 weeks or even more, to fully repair itself and get back to functioning normally after a significant insult.
Are there potential complications to be aware of?
Unfortunately, yes, there can be complications too, depending on the underlying cause and severity. For instance, aspiration pneumonia is a risk if the horse has significant dysphagia, difficulty swallowing, perhaps due to guttural pouch issues, and they accidentally inhale food or liquid down into their lungs.
Recurrence.
Recurrence is definitely a risk, particularly with chronic sinus infections, especially if the original underlying cause, like a dental issue or a cyst, isn't fully addressed and resolved. Guttural pouch mycosis, that fungal infection we touched on, while often causing bloody discharge initially, can lead to severe swallowing problems and potentially fatal hemorrhage if it erodes a major blood vessel. That's an emergency.
And with strangles.
And with strangles, while most horses recover fully, there's a risk of developing serious complications, including a nasty immune-mediated reaction called purpura hemorrhagica, which causes widespread blood vessel inflammation. So considering the sheer number of potential causes we've just walked through, from teeth to sinuses to pouches to lungs, and then the highly specialized diagnostic techniques needed like endoscopy and CT scans, and the often intensive treatments involving flushing and maybe surgery, all for something that might initially just look like a snotty nose. What does this deep dive really reveal? Maybe about the incredible interconnectedness of seemingly separate health issues in the horse. And perhaps, how might this detailed look inform your approach as a listener to recognizing subtle signs in any complex system you encounter, whether it's biological or maybe even something else entirely?